ORENCIA, also known as abatacept. What is it? ORENCIA is indicated for reducing signs and symptoms, inducing major clinical response, inhibiting the progression of structural damage, and improving physical function in adult patients with moderate to severe rheumatoid arthritis. So what is rheumatoid arthritis? Rheumatoid arthritis is a chronic progressive inflammatory disease. It could occur any time in life, but has a peak in people from 30 to 60 years of age. It is also more common in women than in men. The course of the disease is variable. The symptoms range from being minimal to being severely debilitated. It is considered an autoimmune disorder, and there is no single cause. Some causes are a mix of genetic predisposition, environmental factors, rheumatoid arthritis antigens in the patient's system, smoking, etc. In the video, the patient came into the clinic reporting signs and symptoms of morning stiffness that lasts more than an hour, weakness, feeling fatigued, anorexia, weight loss, muscle aches, warmth and swelling of the knees and other joints, etc. After the doctor examined her, he ordered some labs and a radiograph. The labs he ordered were RF, ESR, C-reactive protein, and anti-cultrinated protein antibodies. After the results came back, all the labs were not within normal limits. Also, the radiograph revealed changes brought on by rheumatoid arthritis. The doctor then officially diagnosed her with rheumatoid arthritis and prescribed her ORENCIA alongside DMARDs to treat and manage it. The way ORENCIA works is by inhibiting the activation of T lymphocytes, which are necessary for the inflammatory process in rheumatoid arthritis. It may be used as a monotherapy or with DMARDs. It shouldn't be administered with TNF antagonists. It should also not be administered with anakinra. The patient then was explained the side effects of the drug. First, allergic reactions. Allergic reactions can occur with ORENCIA. Symptoms indicating an allergic reaction may include hives, swollen face, swollen eyelids, swollen lips, or swollen tongue, or having a hard time breathing. If you have hepatitis B virus, talk with your healthcare provider as hepatitis V can become an active infection. While you use ORENCIA, your rheumatologist may do blood tests before treatment with ORENCIA to check if you have hepatitis B. If you have chronic obstructive pulmonary disease, also known as COPD, you may experience breathing problems more often while taking ORENCIA. Call your healthcare provider if you experience any of the following: worsened COPD, cough, and trouble breathing. More common side effects of ORENCIA include headache, upper respiratory tract infection, sore throat, and nausea. In children and adolescents, other side effects may include diarrhea, cough, fever, and abdominal pain. ORENCIA is available in two forms: intravenous IV infusions or subcutaneous injections. You will use ORENCIA subcutaneous injection once weekly. For home use, ORENCIA comes in a pre-filled syringe or pre-filled ClickJet auto-injector. Do not attempt to inject ORENCIA until you have been shown the correct way by your healthcare provider. The healthcare provider will give you a dosage and explain when to take it. Store ORENCIA in the refrigerator at 36 to 46 degrees Fahrenheit or 2 to 8 degrees Celsius. Keep ORENCIA in its original packaging and out of light. Do not freeze. If it is prescribed intravenously, it'll take about 30